In this week's episode, our regular footage will be lined up as usual. We go viral with Dr. Bonolo Mashishi, and she happens to be here. Hi, Doc, how are you?
I'm well, thanks. How are you?
Welcome back.
Good to be back.
Hey, you've been a pop-up doctor for too long.
Well, I'm glad today I'm not, so yes, good to be back, yeah.
And I'm glad to say that you're holding my hand because apparently I need help. Yeah, so thank you for coming back. And later on, we take you to our directory. We find a doctor with you, whereby we look at all the specialists and experts that have been here, walking the streets with us ever since we started this beautiful journey with you. I am Dr. K, and you are watching Ask Your Doctors. As usual, we've gone for the best in the business, and we have an ENT specialist today to handle the topic with us, Dr. Boipelo Tselapedi-Sekeitto. Am I right?
Yes, Dr. Boipelo Tselapedi-Sekeitto, but also known as ENT-with Dr. B.
Awesome. Welcome. Oh, guys, a disclaimer. We don't go for pretty black doctors only. Young and what? Okay, I'm also young, it's fine, and I'm male, so, but it so happens that in the last few weeks, I mean, there has been, Dr. Minga is the co-host here, Dr. Padi has been here, and they're also all young. So, in fact, if you're a young doctor out there and you'd really like to participate with us on the show, do go onto our website, because this is all about us doctors giving information to our audience. So there's no bias here. And so, Doc, ENT. Otolaryngologist, is that how we say it?
No, it's actually
Otolaryngologist.
Otorhinolaryngology, head and neck specialist. Oto simplifies the ear, rhino is the nose, laryngology is the throat, and the entire head and neck as well. So it's otorhinolaryngology.
I'm sure you know why I said oral, right?
No.
I'm a dentist. Everything I've been doing for the last 30 years has been oral this, oral that, yeah. In any case, welcome, Doc. Thank you for making the time.
Thanks for having me.
I believe you practice somewhere here in Joburg. And how is that going?
So far, so good. I started in August after having come back from Canada to pursue my fellowship in rhinology, all things noses and base of skull. So my practice is based at Mediclinic Santon on Peter Place in Bryanston.
All right, nice. Tell me, Doc, what does an ENT no, please don't say the rest of it, because I'm not okay.
Don't worry, I'll teach you later. Yeah.
I mean, I battle with these long words here, and it's always one person being exposed.
Yeah, it's also known as ear, nose, throat, head and neck specialist. In simpler terms, yeah.
That's easier. So what does your day-to-day activity involve?
My day-to-day activity, it's all things noses, ears, throat, pathologies. On specific days, you have a clinic where patients are booked, but now and then you get emergencies. That's when it destabilizes everything, and you do calls as well after hours, and there's also surgical time.
Oh, cool. You're going to tell us a lot more about what you do if we find time in this episode. But what we often do on the show is we aspire to inspire. It's a good coincidence that we always have young black people in general, some very established in the industry, accomplished, long history and whatever. But tell us, if a child out there says, I think it's going to be difficult because I live in the Bundus. I don't know how much Bundu history you have, because most of us do. I will ask Bonolo, Dr. Mashishi, to also give us her background, but I'll let you do it first, as briefly as you can, where you come from, what inspired you to do what you do, because you want young kids to say it's doable.
Okay. So I'm a Kasi girl. I come from Hammanskraal in Unity Timber. That's where I grew up. I was born in Mafikeng. I don't even have those memories, because then, ever since I could remember, from preschool, primary school, I went to Lefufa Primary School, Makhetsi. From the longest time I knew that I wanted to become a doctor, and that's what I worked towards, and I went to Medunsa, and then shortly after that, then that's when I decided to be a specialist. having to be a specialist, I knew that I wanted to be a surgeon, so that was the easy part. So I had to literally look at all surgical specialties and decide that I don't like this, I prefer this, and looking at the hours as well, I was probably inspired by my mentors, but we'll get back to that later. And now I realize that ENT is such a magical place. I mean, when you're inside the nose, you can get to the throat, you can get to the brain, to the eye, and so I thought, let me just try it out, and I fell in love with ENT. And especially for the fact that it encompasses, you work with everyone. So there's pediatrics, there's the elderly, there's the young ones, different genders as well, because I don't want to be glued to a specific gender, so yeah.
And how difficult was it? Did you have to be very smart?
I think it's more of working smart, because you can read from cover to cover.
When you are in matric,
yeah.
Did your mathematics just do it for you, or what does one need?
You had to qualify, so I was doing science, mathematics, science. I did Tswana as first language, English as second language, and Afrikaans. So, you know what, when I was in high school, I just knew you just had to study and pass. There was no in-between back then. I matriculated in 2002.
Okay.
So there was no in-between, whether failing was never an option. So we just had to study, do the work, and yes.
Okay, I'm inspired already. To you young chaps and ladies out there, it's doable. Black child, you can do it. Doc, our dynamite in small packages is Dr. Munolo Mashishi. She's our virologist, resident clinical virologist. Please remind us why we find you here, where you started, briefly.
I started here, Ask Your Doctors, because I was the regular brief for COVID. But my speciality extends beyond COVID. I liked what you said about working with different people and extends. So viruses also know no boundaries or
doesn't
age.
choose.
So it's really great to, I work with gynaes, I work with infectious disease in adults, pediatrics.
And ENTs.
And ENTs. Yeah, so it's a very wonderful speciality. And with all, what you said, basically, you need to have a lot of vision and self-discipline to get there. I still am. Okay. Proudly so.
It's all right, I'm not judging.
No, I'm so proud to be a nerd. Yeah.
Anyways, let's get right to it, Doc. Sleep apnea. What is sleep apnea?
So we're going to break it down. Apnea, it's when you stop breathing for 10 seconds or more.
Oh, right? I see what you mean.
Yes. Okay. And now it's sleep apnea because this happens during sleep.
Does it go longer?
It can go longer. It's multifactorial, because remember, when you have sleep apnea, it means you stop breathing. At that moment, you don't have any oxygen going into your lungs or your body, and you tend to retain carbon dioxide. So some people, it can be long, which is why we have different tools where we need to classify and say, yes, you have sleep apnea. Is it mild, moderate, severe, or profound? So it may go longer.
Okay. And the dangers of it going longer than 10 seconds where you cease breathing?
It's not necessarily the dangers of going longer, it's the dangers of having repeated episodes of apnea. Because then you will have, it depends, in an 8 hours of sleep, how many times are you going to have apnea? Is it going to be more than 5 times per sleep or more than 10 times? So you quantify it as repeated episodes of apnea, meaning repeated episodes of cessation of breathing for more than 10 seconds per sleep, if I may put it that way.
So ordinarily we would have little moments where we stop breathing for a while, but it's not critical. It's nothing.
No,
it doesn't qualify as a diagnostic criterion.
No. Yeah, ordinarily yes, we'll do, especially with kids, but with regards to sleep apnea, before you reach sleep apnea, there are types of like sleep disorders. So some of them that don't meet criteria, you may have like a sleep disordered breathing and also meeting sleep apnea criteria.
Okay.
Those are very interesting points. And I mean, this second part of it, we're talking about snoring, which is a common feature that people experience, you know, day to day. But before we get there, just want to know exactly what you mentioned earlier, that you guys do calls, you get emergencies. What are the typical calls and emergencies that you get in ENT?
So you're thinking ENT, it's all about orifices, like you have mouth, nose, and ear. The most common calls we get is any form of obstruction. Form of obstruction can be in a form of foreign body. A child's putting a battery in the nose or battery in the ear, or a bead. You know, you're untying a little girl's hair, you turn around, they put a bead in the ear and the nose. Or it could be mostly more systemic, whereby there's an inflammation or a tumor. So that tumor has now grown so big that it's blocking your airway and you can't breathe. So that's our day-to-day. So it's mostly blockage, either structural or more inflammatory related.
Okay. Thanks. Yeah.
The show is called Ask Your Doctors, and what we do, we project ourselves to the audiences as people who let the audience ask all the questions. So we pretend we own the show now and then, but we don't. So the questions sometimes come very raw from the audience. You should have heard in the last few weeks when we were talking about reproductive health. The questions were very raw, but today we are safe. It was fun.
We're all up here. We're safe. It's all up here.
The other end. Anyways, Doc, someone says, yeah, I snore like a buffalo and I need help. And what's the first point of call? It says it comes, you know, I snore like a buffalo. Don't even know if buffalo snores, but I hear what
I think because buffalo is big, I can also imagine. I think the snoring is quite significant.
Quite
probably waking up the whole house.
Quite loud.
Partner sleeping in the other room, and that's a real story. That's how we get to tell the significance of the snoring.
The problem.
Yes, but I must say that it doesn't matter how loud or quiet you are, snoring is abnormal. Because remember, when you're snoring, it says that at some point when you're breathing, there's a narrowed passage. You breathe from the nose. So if you can look at my mannequin here, you bring, this is the tip of the nose, and this is these are the lips. So you breathe from the nose, going all the way at the back of the nose. This is the nasopharynx, and going down the throat till you reach the vocal cords. That's the pathway towards the lungs. So you can imagine when you're having snoring, as an ENT surgeon, it tells me that there is some form of structural narrowing, yes, that I need to look at. So when you are snoring, you need to get checked by ENT because it's multifactorial. It starts from non-anatomical causes, such as excessive alcohol use, excessive sleeping tablets. And the number one cause I must mention is increased BMI, obesity, because you can feel healthy or look healthy, but if your BMI is above a certain variable, that will squash the inside of your airway. Remember, your airway starts from the nose all the way down into the voice box. So when you do think you snore like a buffalo, you need to be checked by an ENT surgeon because it's multifactorial.
Before you participate, what is the protocol of referral? Do I go to my GP as the first point of call, or do you taking walk-ins and?
Yeah. So in South Africa, we're quite liberate because in other first world countries, neighboring countries, more like in Americans, you need a referral. So in South Africa, if you think you need to see a specialist, it's by booking. So you call in to book, and then you'll take it from there.
Okay.
Or sometimes it's more of you have a colleague, or they're seeing you as a dentist, and they tell you about their problems, and you can also refer. Okay. It depends.
So if you are snoring out there, please check your weight, check your lifestyle. I often say to people that alcohol swells up your membranes. It irritates your membranes, they swell up a bit, and then you get a lot of phlegm. So there is a lot of disturbance that happens.
Yes.
Yeah. And to our viewers out there, most of the time when you send us your questions, we want to make the space online as safe as possible for you. So you notice we keep your questions anonymous for obvious reasons, unless you ask us to tell your name. But also it's better if you go to our social media pages and post your questions on our DMs and on our messaging app, because that way you know that only we will view your questions. They don't have to be on the timeline where the public can view them. That way maybe more people will feel confident to say what they want to say. Yes, ma'am. She's all yours.
Yes. No, I think you've raised very important and issues that we commonly deal with and see in our day-to-day: alcohol, obesity. So, what impact would lifestyle modification have for people who know they snore, maybe they're still in denial, and don't want to come see you, but they want to make a change?
Yeah. So I always say that weight gain, or rather being obese or fat or having like an abnormal BMI, is the #1 cause. But for some people, their BMI is even low or normal, because it's all about structural.
Yeah.
So you think the first thing you do when you breathe, it starts from the nose.
Yeah.
So inside the nose, you have a septum in the middle, dividing the nose into left and right nostril. So some people can have a significant deviated nasal septum, meaning septum is a bit skew, and this could be related to trauma, even when you're young. Any blunt trauma to the face, it can just bend the septum a little bit, and as you're growing and your facial features are also growing, then you end up having a nasal septal deviation that is significant. And speaking of structural, now all the way at the back of the nose, some people get things called adenoids. Adenoids is the same family as tonsils. So if you can look at my mannequin, this is where the adenoids sit. You won't forget what adenoids are, because that's where they do a COVID test. So some people's adenoids swell up, and they're there for a reason. They're there for, it's like first line defense of immune system when you're having flu, any irritation inside the nose, right? So now when they swell up, if you can look here, they're just sitting by the neck, by the spine. So what they do, they're actually blocking the nostrils at the back of the nose. So now when you sleep, and you actually sit like this and everything relaxes, then you have narrowing that causes significant snoring. And now going down to the throat, this has to do with people that have large BMI, because when you're fat, you're actually squashing everything from the inside. And for some people, they don't have all the anatomical sites that I've mentioned, but they have large tonsils. Because remember, when you snore or when you get blocked through the nose, automatically your body says, open the mouth, breathe through the mouth. But you find that you have large, big tonsils. So
we're just speaking about general ways in which we can assist people who are snoring. And that's very great. I think people should consider that, there's options and lots that can be done. So if we have to go back to our conversation on sleep apnea, we mentioned how, people are not getting enough oxygen as they, that's compromised. And the solutions include, newer technologies such as CPAP. Can you maybe tell us about that, how it works, how we can improve your sleep apnea?
Right. So CPAP stands for continuous positive airway pressure. It's basically a device that stents your airway. We're saying there's narrowing. So when there's continuous pressure, it's a device that you can put either through the nose or over as a face mask. You have to sleep in it. You can imagine it can be quite uncomfortable, because you have this air blowing either into your nose or into your mouth, so that it can stent and open the pressure. So you also, because of based on our criteria, you have to qualify for that. And for instance, you have large big tonsils, you have septum deviated to the other side, meaning you're breathing through the nostril. Most of the time we know that CPAP is not going to stent anything. Only surgical intervention can help. But some people do not even qualify, they're not fit for general anesthesia to go to theater. So we end up having to improvise. And CPAP being the last resort, some people have devices whereby that your nose is quite narrowed, so you get like nasal cones where you have to sleep putting something inside the nose to stent your nasal passage, or you have a jaw that is slightly backward, because if you imagine if your jaw is pushing backward, it's going to push the tongue like this, and now for you to sleep better, now you use a mouthpiece where you have to, it helps to stent. But you can imagine if you want to get a good rest, beauty sleep, you don't want anything on your face blowing and whatnot. But CPAP does help. There's a nasal CPAP just on the nose, and the mouth one wears a face mask.
So if I have to just ask, if those things may potentially be uncomfortable and invasive, I don't want to sleep like that, I don't know about you. What other options are there? I mean, not everybody qualifies for CPAP like you told us, so what? What options do I have?
So number one, I can't stop to, you need to know there's losing weight is the number one cause, right? The number one way you can improve sleep apnea. Then we start thinking of surgical intervention. But surgical intervention is also subjective. It depends where subjectively there's narrowing, significant narrowing. If it's inside the nose, for nasal surgery, we can straighten the septum. We don't cut anywhere from the inside. Everything is done endoscopically. We can remove the adenoids if they're large at the back of the nose. But when it comes to oral surgery, now when you open your mouth, you have tonsils on the left and right. They're quite big that they're blocking the back part of the ears. So now you have to qualify for that because you won't have any significant, you won't be able to tell significant change if your BMI is more than 35. I go as low as BMI of less than 32 so that we can get, you can tell the difference.
So the aim is really to target the root cause.
The root cause,
the root cause and just to solve
BMI refers to body mass index, right?
Body mass index, yeah.
Just a quick one on the mouthpieces. As a dentist, I haven't done one in over 26 years working. How do you collaborate with colleagues on that one? Where do they get it from?
So what I usually do, if we really, really need to tell, that is, if you augment surgically the jaw, or if you use a mouthpiece, it is going to help. First of all, I do a procedure called a sleep endoscopy, where we induce you to sleep in theater, and we put the camera through the nose and actually look on the monitor and see what happens when you snore. Is it really by the tongue area or is it lower down? Is it something that we need to augment? And you find that some patients, it's the jaw. The jaw is quite moved backwards. So as you tilt the jaw, you actually open up the airway. So that's how then I get to correlate with colleagues. And we always say that you can find a mouthpiece over counter, but each to their own because the anatomy is different. And if you want to be comfortable, you don't want a mouthpiece that when you wake up you have sore teeth or choke on and whatnot. So that's how it's a multidisciplinary. We work with orthodontists.
I'm available too.
Yeah. We work with dentists, we work with neurologists because we know of what sleep apnea has, the effect on the brain, and like I said, it's multifactorial.
Okay. This sounds really costly and expensive. So what is the best way in terms of cost perspective? You know, how do medical aids cover this firstly? And if I don't have medical aid, what is that like it for me? It sounds very costly.
It depends because even within South Africa, medical aid, we have different varieties, different standards, different levels of medical aid. So it depends. But remember, the same specialists that are in private hospitals, we get trained in government hospitals. So if you cannot afford any private consultations, the best thing then will be to go to our neighboring, to government hospitals.
And for that, particularly, clinic or something?
No, particularly tertiary hospitals. Because all the tertiary hospitals, meaning all the hospitals in South Africa that are attached to a university or a medical school, they do have specialists on site, so they can do the work. Not an ordinary clinic or a level 1 or 2 hospital.
Okay, tips concerning snoring?
Weight loss.
It was just January now. Everybody, you know, was on that journey. So I'm hoping, you know, they still.
When in doubt, record your sleep. There's different apps that you can do because we need to know: do you have snoring or do you have sleep apnea? Because you know that the sleep apnea is detrimental to the heart. The longer you retain carbon dioxide, there's so much pressure on the right side of the heart that you may ultimately have right side heart failure, right? And weight loss is number one. And when in doubt, consult ENT.
Okay, and devices for kids, is it the same thing that it will be subjective to what the doctor says? No,
the kids it's very interesting. I'll say anyone below the age of 16, 14, right?
Those are not kids.
That's what pediatric age is in South Africa.
12-year-olds are adults these days.
Okay. Take, for instance, a 5-year-old, right? Remember earlier I spoke about adenoids, and I said adenoids is the same family as tonsils.
Yes.
So the most common cause of kids to snore and end up having sleep apnea, the number one structural cause is adenoids. Ideally, on an average normal human being, adenoids are meant to regress, or rather like disappear by the age of 5 some boys are laid up to the age of 18. So if you have significant adenoids that has been working over time because of repeated flu, repeated upper airway, and like infection, snot and whatnot, with kids, the easy way is to remove those adenoids and tonsils. So kids tend to do way much better. But like I said, it's multifactorial. If we're dealing with an obese child with other underlying conditions, it's also, it depends.
Okay, Doc, thanks, very insightful. Guys, you've heard for yourself, ENT. Now, we have to go viral with Dr. Bonolo Mashishi, and this time she doesn't pop up, she pops up right next to me. So before we wrap up, you will give us details of where we can all find you, but I'll reassure people that they can also find you on our website, on our directory. Dr. Mashishi, Doc, feel free to interrogate if you want.
Noted.
There's stuff that you want to ask a virologist about, all this stuff. Anyway, over to you, Doc. What's the latest you want to tell us?
Well, firstly, I'm glad we're out of the fourth wave, you know. It was a bit scary, I think, because when it started, it was like, oh my gosh, this could be really massive. So I'm really glad that we got out as quickly as we did. And with the fourth wave, I think there was a lot of interesting things that were happening. You know, regulations changed. There was just a lot of information coming our way. So, I mean, from our side, we saw that, you know, the president recently talked about quarantine and isolation. So if you don't have symptoms and you came into contact, you don't have to isolate or quarantine. And also the isolation.
Unless you have symptoms, yes.
If you don't have symptoms, yes. Okay. If you have symptoms, you have to isolate, but that has also been changed from, you know, the previous number of days to now 7 days. So that was a lot of changes. We saw changes with the curfew. So yeah, it's been very interesting in that regard.
Do you think a fifth, sixth, or 10th wave is coming?
The arrogance with which you ask.
No, because we've been at it.
Fifth, sixth, and 10th. No, I think it's certain that, you know, the virus is still evolving and the evolution is not going to stop. What is less predictable at this point is how that's going to play out. There's a lot of factors that, you know, come into play. Vaccines now, more and more people are getting infected. That means natural immunity also plays a role. Our behavior will always play a role. The policies we place will always play a role. So I think because a lot of countries around the world are still in their fourth wave, it's still very early days, basically.
So, sorry, Doc. The fact that Omicron gave us mild symptoms for now, everything is for now, is there anything we can bank on for the next batch of symptoms with the waves that are coming up?
Again,
hopefully they don't come up anymore.
It's very unpredictable because it also depends on you know, what variant may come up. I mean, already now we're seeing subvariant of Omicron.
Tell us more.
I mean, the Omicron that we saw in December is not what is currently happening, and it's not happening around the world. But that hasn't changed in terms of the number of people getting sick that they need hospitals, but it has placed a significant burden on hospital care in some other areas. So it's really dynamic at this point, and we don't know what's going to come. So it's still very early days. We have to wait and see.
Okay, let's talk about what we may know. Does cold have anything to do with the wave being west? And it's snowing in the US now, and they got cases, and they got what's
snowing. It's cold.
Yeah.
I think the temperature has some role. Some viruses tend to survive a little bit longer in certain temperatures. Also, I mean, weather conditions also impact on our behavior. Generally, like what we see with respiratory viruses, we have seasons in winter because we huddle more, we're closer, you know, that sort of thing. That's where we see a lot of cases generally. So, yeah, it plays a role. I don't know if that answers the question.
You happy, Doc?
Well, I don't know when the 5th wave is coming, but I'm happy.
I'll let you know.
All right.
I'll let you know.
Geez, we'll all find out one way or the other. Tell me, Doc, related to your work, how do you think you guys have collaborated? You said adenoid is where we take our swabs and whatnot. How has COVID affected your work?
So there's the good side and
Briefly.
the not so good side. So the not so good side is that we had to go where COVID resides. I have to look inside the nose.
Oh, yes.
And to say that all my patients that have allergies related, it could be seasonal, it's spring, it's pollen, everyone that's coughing or sneezing, those are my daily patients. So it's very tricky because most patients are being isolated, kids are not allowed to go to school because they have allergies, and you may find this is chronic. It's seasonal change. That's why they're snoring, they're sneezing, or they are snotty, and it's not COVID related. And another thing, one of the bad side is that we find the technique of having to perform the nasal swab. Remember earlier I told you that nose is a magical place. We've had patients whereby someone just went straight into the brain, or they bled so significantly that they had to end up in ICU being intubated, and it has its own side effects for just doing the nasal swab. And the other good side of things is that the more patients, I don't know if I can put this on
don't
air.
say that.
Yeah, the more is that, as I mentioned, nose is closer to the ear. So there's a special tube that opens in the middle part of the ear, and it opens at the back of the nose. So rest assured that every time when you have any nasal symptoms, and if you can look at my mannequin, this is where that tube resides. It's literally from the ear and opens at the back of the nose. So you find that most patients that suffered any viral infections such as COVID-related or flu, 6 weeks down the line, they still have ear symptoms. Then you end up having a lot of influx of patients having water accumulating within the ear, because that special tube is the air condition of the ear, and it's not working nicely because the nose is stuffed and inflamed.
I was diagnosed with asthma, my last contribution, in 1993. And one thing I have to admire, my asthma got better, and my nasal and sinus irritation and my symptoms that made me not be functional got better as soon as I was exposed to antihistamines.
Yes.
I must say, I must commend, recently I came across patients that had said when they went for ENT consultations, some ENT actually chose to put them on antihistamines for a while to see if that could tame the allergy scourge. And I commend ENTs because people are always known to wanna, in our case we drill and fill.
What is this?
Cut, chop, surgeons, you know.
Okay.
Especially orthopedic surgeons, but we won't go there.
That's close to home. But
Anyway, yeah, I must commend you guys. That approach inspired me because without any surgical work, as soon as I knew about preventative medication, then my allergies got better and my symptoms got better. And yeah, you guys are doing a good job.
we're surgeons, but we're also clinicians. So for you to go under any surgical intervention, you need to meet the criteria. It's subjective. So we almost always try medication, and preferably topical medication, sprays, anything you can put in the nose, antihistamine that you say, before we think of surgical intervention. But also it depends.
Okay.
That's the moral of the story today.
It depends.
Yeah, I like that
See when you have ladies dominate. I don't know what it depends means, but is there anything you want to ask that is relevant to the audience? Not it depends. It's something better.
No, I'm good.
Are you
But
covered?
I'm really glad that we had this conversation. I think it's common that people experience this now. They know what to do and where they can seek help. Yes.
Doc, where do our audiences find you?
So you can
platforms, location.
You can find me on social media platform, Facebook and Instagram, as ENT-with Dr. B, one word, or you can visit my website. It's www.entwithdrb.co.za, or you can come visit Senton Mediclinic, the one on 1 Peter Place, because most people end up going to
Morningside,
Morningside, no. So the one in Bryanston, it's
Yes.
1 Peter Place Road, Suite 204. That's where all my other ENT colleagues are. So as soon as you get to Santon, they'll direct you, Santon Mediclinic, where to find me.
Once again, Doc, thanks for making the time.
Thanks for having me.
Please don't be a stranger.
And I'm waiting for the next invite.
Cool. You can set your appointment now. Dr. Bunolo, where do they find you except when you pop up?
So I don't have a physical location where I can be located.
That's what I said. You
but-
pop up everywhere. Anyway.
I am everywhere and everywhere, just like the viruses. But I'm available for all your questions on my social media platforms, Instagram, Twitter, Facebook. I'm there.
And what's your Instagram handle? At least one.
My Instagram handle is Dr_Mashishi.
Okay.
Yes.
Thank you, doctors. It's
Thank
been
you.
lovely. And thank you for the insightful information as always. Guys, it's been good having you. Until we meet again in another week, please remember social distance. Please remember to click subscribe and go to our social media pages. Load your questions there. Who knows, maybe your question will be read on air next week. Until then, please ask away.